Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for corns and calluses. What are corn and calluses? Corns and calluses are build-up of hard, thick areas on skin. They are developed mostly on our hands, finger, feet, toes, where much friction goes on. Corns generally develop on pressure points like bottom of feet, sides of toes. They are smaller and generally painful. Calluses are hard, thick patch of skin where friction goes on a larger surface. They are larger and generally not painful. On the right hand side, pictures of a corn and calluses has been demonstrated. What are different types of corns? Corns may be of different type like hard corns, soft corns, and seed corns. Hard corns are small, hard, dense area within a large area of thickened skin and seen on the top of toes. Soft corns are grey or whitish and possess softer texture that appear between toes. Seed corns are small and generally seen on the bottom of the feet. What are symptoms of corns and calluses? A thick, rough area of skin, a hardened area of skin, dry, flaky or waxy skin, pain or tenderness under the skin. Are corns and calluses the same thing? Corns and calluses are not the same thing. Corns are smaller, deeper than calluses, have a hard center surrounded by swollen skin. They are often painful to touch. Hard corns are formed on the top of toes and outer edge of small toes. Calluses are seldom painful and tend to develop on pressure spots such as heels, balls of feet, palms, and the knees. They vary in size and shape and are larger than corns. Pictures are on the right hand side. Very relevant picture. This callus. Look at the callus, the area. Corn, the area. Smaller, bigger. Hardened, soft. When to consult a doctor in case of corns and calluses? If a corn or callus gets a painful or inflamed, one must consult a doctor immediately, lest it gets infected and creates a storm in a teacup. Storm in a teacup means a very serious problem arising out of a little thing. There is storm in a teacup. Corns and callus are like this. Occasionally it happens that a small corn gets painful and the whole feet is in a septic condition. Quite possible from the ulcer. Please remember, even a minor injury to foot can lead to an infected open ulcer. Furthermore, this is a serious fact that if the person happens to be a diabetic, in case of diabetic patient, the infection of corns and calluses is very serious thing. Mind it. Better one should not try self-attending a painful corn at any time. Better one should not try self-attending a painful corn at that is, one must consult a doctor for painful corn and calluses. How corns and calluses can be prevented? Try to wear soft shoes. Use more than one shoes. Wear different shoes in different time, because If you wear different shoes in different time, the particular portion, the pressure points of the shoes will change, because a particular shoe touches definite portions of feet. If the shoe is changed, the portion, the pressure points are also changed, and that change will facilitate uh, just not developing corns and calluses. If corns and calluses tend to appear, try to use Vaseline or unaffected part. That is, suppose you are wearing a shoes, that shoes is new, and you see that within 2 or 3 days there are some portion in your feet which are getting painful due to extra pressure. You can directly use Vaseline on that points. Directly use to minimize the pain, and that will also prevent formation of corns and calluses. Discussions about treatment for corns and calluses with homeopathic remedies. Antimcrude for corns and calluses. Tongue heavily coated with whitish layer. Corns appear in shoals. Waves of love in mind during moonlit night. This is a mental symptom of antimcrude. Very interesting mental symptom. Waves of love in mind during moonlit night. If the patient is of antimcrude, whether he suffers from corns and calluses or gastric problem or some constipation, etc., there are so many diseases covered by antimcrude. Everywhere this symptom may be there. The waves of love in mind during moonlit night, because it's a characteristic symptom of antimcrude in mental sphere. Hydrostasis for corns and calluses. Tongue has imprints of teeth covered with thick yellow slimy coating. Digestion very poor with inveterate constipation. Acid nitric for corns and calluses. Very cold patient. Cold patient means he cannot tolerate cold. Sensation as corns are pricked with sticks. Tongue very much salivy, obnoxious odor in mouth. Calcarea curve for corns and calluses. Patients heavy with fatty muscles, slow in movement, like open air, but cannot tolerate cold. Both breasts tender, menses scanty, ovaries dry up, vertigo and suppressed sexual desire. Phosphorus for corns and calluses. Skin burns on shaving. Small wounds bleeds much. Purpura hemorrhagica. Purpura hemorrhagica is a special type of disease. When there is 1,000-ton pinpoint bleeding under the skin surface, all over the skin surface. There may be whole body, maybe part of the body. Pinpoint bleeding. Innumerable. Corns and calluses with fatty cysts. Silicea for corns and calluses. Eruptions, itching during daytime or evening only. Corns and calluses are painfully sensitive. Little injury tends to suppurate. Sulfur for corns and calluses. Itching in corns worse at night in bed with burning sensation. Skin unhealthy, rough, dry, scaly. Patients drink much, eat little. They eat anything and everything. Desires for sweet, averse to meat. They are characteristic of sulfur patient. Desire for sweet, averse to meat. Drink much, eat little. Lycopodium for corns and calluses. Persons with gravity. Mind cool. Problems of digestion worse during 4 to 8 p.m. Suffer from pain in liver.